and I'm Divisional Manager for U.S. Health Advisors. Birsen is one of our up-and-coming agents, been with the company about three or 4 months. And what we do is help self-employed and small businesses. That's what we're about. We've been around 54 years with my company, U.S. Health Group. We've been the backbone of helping small business self-employed. Small business self-employed have always been overlooked by the big carriers, the Aetnas, the Humanas, the Golden Rules, United Healthcares. Basically, we're built to handle the large corporations, the General Motors, the Disneys, and those big employer groups. They dabbled in self-employment forever, and historically, when you got sick on their individual plans, that's when the rates started really climbing because they did a thing called class shifting. My company has never rescinded or canceled or moved, singled out any self-employed small business members for any reason. So once you're into our pools, dating back for 54 years, we never get rid of you when your health changes. We don't single you out for rate increases or cancellation. We spread you amongst a 15 million member group. Moving forward, everybody understands what the PPACA law is, right? The ACA law, Obamacare. We all know it is Obamacare, right? Around our office, we call it Obamacare sometimes because it really is affecting my clients, self-employed and small business, the worst. And I'll show you some price tags. I know you looked at some for yourself and different things, and we'll talk about that. The law in its essence is pretty good, right? Particularly if you're self-employed. Once you get insurance, you shouldn't have to worry about pre-acts. You don't have to worry about getting canceled or whatever the case is. So in essence, that law should be one page long. Can't pre-exist anything, got to take everybody. And it's got to be all, throughout the nation. It was about helping the uninsurable. But what has happened as we see this rollout, this one-page potential law, has climbed. It has over 15,000 pages now. 15,000 pages. The IRS has built a large 18,000 member group right next to the Health and Human Service building. Why? This law is a lot more than just about health care. Health care, and just because you have health insurance doesn't always mean you have health care. You can have great health insurance. The ideas behind this law were to try to reduce the amount of ER visits. We had more primary care physicians. In the first 2.5 months in 2014 compared to 2013, there's already a 45% increase in the amount of ER. If you haven't been to an ER lately, go to one. Walk in and see how long it would take you before you get care. It's unbelievable. At least the hospitals that are accepting Obamacare, of the 18 hospitals in the nation that are classified the best hospitals in the nation, 11 will not see anybody that's taking Obamacare at all. They will push you away and say, got to go someplace else. It's almost like fishing, though. They will stabilize and release. My sister is medical information director at Cookeville Regional Hospital in Cookeville, Tennessee, and they're not accepting any Obamacare, but they will stabilize and release. If you came in with your arm falling off, they'll put an ice pack on, put you into the ambulance, and send you to the next hospital. And the reason being the low payment of claims. Basically, doctors don't want to be Medicaid doctors, so we're having this idea of trying to insure all Americans, and as Americans, I think we're the most giving nation in the world, that we'd like for our neighbors to get. If you had a neighbor, even if you didn't like him or her, you'd still want to see them get proper health care treatment when there was an emergency. Agreed? Good, I like an honest answer. Yeah, for the most part, yes. Fair enough. There's a better way to say it. Yeah. Okay, fair enough. But the idea is kind of neat in its premises. But what has happened is that as this law has rolled out, and everybody know it rolled out very smooth. The website was perfect. And it rolled, but the website was the tip of the iceberg. I've been doing this 22 years, and I've seen every horror story imaginable to mankind out there when people got cancer, strokes, heart attacks, the big ongoing issues. And I've seen people get canceled from their Blue Cross Blue Shield. I've seen people go from $300 a month to $3,300 a month after the wife got diagnosed with breast cancer and things of that nature. Didn't happen overnight, but within a year or two, it became so unaffordable they couldn't afford it. Big businesses, when we work at big businesses, most everybody understands the COBRA laws, or what used to be the COBRA laws. That when you left, you got to see the full price tag of what that big business was paying for you and your family's insurance. And that people get sticker shock, they're really screwing me. No, what they really was doing was the COBRA was the absorption of how much you were paying and then how much they were contributing. So it really changed the law a lot. In March 23rd of 2010, the PPACA law was the full name, Patient Protection Affordability Care Act, Obamacare. And the president, as you see now, is not wanting to talk about Obamacare anymore. He refers to it as the ACA law, if you haven't noticed. When it first came out, the press coined Obamacare, and he liked it, just like President Hillary did in the early 1990s and during Hillary Care. And now he's running away from it as fast as he can. And I'm going to talk about those prices like you had mentioned on a certain platinum plan and why I'm certain they'll go up besides the 22 years of experience. I could sit and become a realtor with y'all in 10 years. You all would still know 10 years more than I. Okay? You could teach me everything you knew today, but then you'll be 10 years more wiser. I'll never catch up to you. So I enjoy and I love working with our company because we ultimately work for you. That's who we work for. Okay? So when this law was passed in March of 23rd, 2010, we're the only company in America, the only company that filed most of our paperwork outside the ACA law. The only big name, only one. The other companies might have been bought out. You'd never know. I could go on and on about it, but I'll give you just a quick synopsis. 3 years ago, you couldn't open the USA Today or any publication without having the Aetna president talk about how Obamacare will destroy healthcare in America. You couldn't find a Cigna president doing. They were all over the press. They were all. Where are they today? They're hushed. Okay, the Aetna president came out a few weeks ago finally and said we got to double our premiums on the Obamacare intake because all we're getting are the uninsurable and the people that are the least poverty Medicare eligible patients and Medicaid eligible patients. So when they said that, boy, it hit the press real fast and it was backed off. He got quieted real fast. I don't know Chicago politics that well, but there must have been some reasons he was quieted. Because he said basically he needs to double their premium already on prices that are already this high because all they're getting is bad risk. The unions, the administration's friends, the big businesses, they've all been put off where they don't have to worry about this law for a couple years. Self-employed, those groups from 50 to 99 were put off for one more year because the Senate is sided with the president on their demographics, and the president is worried about losing the Senate in November of this next year. And that's why he put off the open enrollment for Obamacare for 2015 to after the election. It was supposed to be before the election. He said, insurance companies need a little bit more time for their actuaries to figure it out. That's not true at all. They've already figured it out. Prices are going up. He wants you to vote before you have the sticker shock. Now, I'm not against this law completely, but for my clients and self-employed and you, it's a terrible law. Because basically, as everybody else gets to skate, you're getting the highest risk people coming into your pools. And if you don't get any types of subsidies, and I truly believe, I've done this a long time, I've seen Tennessee almost get bankrupt because of the 10 care laws. Not everybody in Massachusetts loves the law up there, okay? The employers don't. The employees do, right? They get it paid for by the employer. The employer's banging his head against the wall, okay? Because the cost has become astronomical for them. And the long waits to see a specialist are unbelievable in Massachusetts, over 63 days. So if you had to go to an oncologist or your wife had to go to an oncologist, call them up, boy, my wife's stage 1, well, can I get her in tomorrow? I don't know. What does May look like for you? And that's the trouble, okay? Doctors don't like this law overall. And I do about 15 surgeons that are specialty surgeons that are my clients here in Central Florida. You know how much they've seen and done some work for Obamacare patients. Here's how much they've made so far and collected. It doesn't take a rocket scientist to say, man, something's got to give. When you need health care, you want to get it. A reason I love working with self-employed individuals, very simple. We don't abuse the system by nature. We want it for the what ifs. We don't carry our car insurance to have the oil changed. We carry it for when we get in a wreck. Okay. And some people want everything carried. We can do everything, or we can do a few things. I'm going to jump into the way we solved this solution, and very quickly again in March we filed outside. We continued to work. We're one of the few companies. When this law was passed, it was 2,200 pages, escalated to 15,000 now. But when it was passed, one thing that we realized, and we took it straight apart, how could we help you still and still underwrite and keep prices down with still the guarantees that we don't cancel rates out, give you 3-year rate guarantees, and give you freedom to choose any doctor, any hospital. None of that's important until it becomes important. Really. If you're perfectly healthy, nothing wrong. Everybody knows a cancer victim. Everybody knows a heart attack victim. The heart attack used to kill us 80 years ago. It doesn't kill us anymore. It's the financial stress after the heart attack that gets us. Okay, so we have a way out. We think it's a very beautiful way. And when I'm done with my presentation, there will only be one objection that all of our clients are giving us. It's too good to be true. And I'll tell you how we do it and why we do it. Lighting the way for small business individuals and family through the Southern Consumers Alliance. You are a member of the Southern Consumers. We do a lot of different things to help small businesses and self-employed survive and succeed. I'm not sure if it's on the back of Birsen's card, but on the back of my card, one of the benefits that we do is a thing called Call MD. It's kind of funny, but I love it. It's one of the smaller benefits of the 130 that we do, but the 130 that we do, I want to talk about just one or two of them. The first one is this. When you wake up, who's married in here? Okay, most everybody. Well, cool. I usually like when people say, not us. And I say, all right, I like working with smart people, divorced twice. But anyway, I'm just joking. If you wake up and you have a house to show or a commercial property to show, and you've been kind of getting this nagging crap, and it's been going around a little bit, and that everybody's getting a Z-Pack to get it cured, and your wife kicks you under the covers and says, or husband, and says, honey, will you please get something? You got snot on the pillow. You're keeping me up all night. You're coughing. Man, I can't quit working. I'm on a roll. Wouldn't it be great to be able to call an 800 line, talk to a board-certified doctor in that area of expertise in the state that you reside? They can call in a simple prescription for you. It's a beautiful thing. It's free benefit through my association. I, get my annual 5-year physical, whether I need it or not. But, you might get a physical every year. And some men we just don't go as often. Women, of course, almost every year, like clockwork. But I haven't been to a physical doctor for a few years because I haven't had to. Now, it's not that I haven't gotten sick. I have a little mole underneath my left eye, and sometimes I get a little dirt, and it creates a sty about once every other year. I call them up. You talk to a nurse first, give her your symptoms. About 10 minutes later, doctor calls you back and says, what's up? And by this time, if they've been in the system, he calls me Jim. Says, what's up, Jim? How can I help you? I tell them the problem. They call me in a $5 antibiotic. I go pick it up 30 minutes later. Never have to go set foot in a doctor's office. Doesn't cost me a penny to do it that way. And I absolutely love it. So that way, if your wife kicks you in the covers at 3 in the morning and says, honey, you got to do something. You're right, man. I want to be able to make this appointment tomorrow. You can call up at 3 o'clock. It's 24/7, 365. You call up at 3 a.m., have your prescription called in at 3:10, go pick it up at 4 a.m., come back, get 3 hours of sleep and already being on your antibiotic before you're showing. At least you're feeling like you're getting there. Antibiotics take a little bit, but at least you already know you're on the way. Because the last thing I like to do is go into a sneezing, sniffling doctor's office where all the kids get you sicker when you go, and it saves me time, more than a $35 copay. I'm not worried about that. I'm worried about that time frame. Self-employed people love it. We also make sure we cover up your accidents, and we also give you money through the association. Should you have any serious illness and you're in the hospital for a period of time, depending on the level of the association, we give you anywhere from $400 to $800 a day while you're hospitalized. And that's important when you're self-employed, because if you're in the hospital, or if your wife's in the hospital, you married? You were one that didn't, you're a smart one, I forgot. I'm just joking. But married. Your wife's in the hospital, where are you? You're in the hospital, right? I mean, if you love your wife. You're probably in the hospital too. So you have some income that you're missing that we try to give you a little bit back. We do a lot of things like Aflac on steroids that are built into our product. And again, it goes back to that 15 million member association. We have 15 million self-employeds nationally that belong to us. 15 million buy a lot of benefit for a nickel on the dollar. Okay, we do some identity theft, roadside assistance for any vehicle you're in, and those are all free benefits that come with the association. We use both the PHCS PPO network, U.S. Health Group, and we also use the Cigna network. I'll explain. These are two of the nation's largest networks. Excuse me. We can both call MD. Just joking. The PHCS PPO network and Cigna networks, and we use the U.S. Health Group. We buy into these networks, okay? We don't own the networks, but Cigna and PHCS private healthcare systems are two of America's largest. 92% of all doctors in America belong to PHCS, 97% all belong to Cigna. Every hospital in the state of Florida are both PHCS and Cigna providers, just so you know. So one more thing about Obamacare, that the networks have been watered down. When you bought your plan, it might have said EPO, which is Exclusive Provider Organization, and most of my clients, until I tell them that, they don't know what they've really bought. They don't really know who their network is. Fair enough. Fair enough. A lot of them don't know who their network is, but EPO is an exclusive provider organization, which means you have to go to one doctor and one hospital. Better not travel, okay? PPOs are much better. HMOs, we're more familiar with that name, Health Maintenance Organization. And the HMOs can be very small. And the reason they're getting small is because, again, the insurance companies understand, and the government understands that if you can't afford $3,000 a month, one way to keep that premium dollar down a little bit is by rationing, going into their old PPOs and pulling out their cheapest doctors and saying those are the ones we're going to use. We do a lot of, I have a satellite division in Brevard County, and the Blue Crosses there that are on Obamacare, the closest orthodontist, foot doctor, what's that? Podiatrist. Closest podiatrist is in Ocala that they can use. So if they have a problem with their feet, they got to drive to Ocala, and that's after getting an appointment. It might be 90 days later. I think you're catching my drift. Kathleen Sebelius, who's the HHS czar, changed her name back to secretary. I heard a boo. Kathleen Sebelius, I loved her statement in Congress. Said they asked her about the Obamacare, and she said it's the law of the land. And they said, "Well, you're signed up for it, right?" And she said it'd be against the law for me to sign up for it. Back-to-back statements, honest to God. And she was the governor of Kansas, and when she was the insurance commissioner of Kansas, what she ran her platform on for to become governor was, has your insurance commissioner. I ran off all the HMOs. They're terrible. Rationalized medicine. Man, people die on them. Lucky for me, I ran them off. Now, out of her other side of the mouth with Obamacare, HMOs are wonderful. They're the best things since sliced bread. You can't talk out of both sides of your mouth, No one would buy from you if you told them a certain thing about one property and then contradicted yourself, right? So it's sort of funky there. So anyway, our networks have not been watered down. We still use the entire national networks. Who is U.S. Health Group? And I've told you a little bit about us. 15 million, just have a little, there it is. Anyway, 15 million customers served. We actually do business in 35 states, 15 states. We don't market in. However, you can take our insurance is completely portable. So if you ever wanted to move, we can never get rid of you once you're in with us, period. Okay? That tells you a few different needs. You want great customer service? We have if you notice the amount of, yes, I'm sorry. Any doctor, any hospital worldwide, in or out of network. But you'll get a better deal if you stay in network. Absolutely, we are completely portable. You can take it in any of the 50 states, even if we don't market in those states. Insurance law is correct, but when you go to a different state, we still are portable. We'll allow you if you move to New York State, but in health insurance, you do have to buy it with a state approval. Okay, so everything we're approved in the state of Florida, for example. So, but when you buy it, what we've done is make sure that it's completely portable to you. So but you have to buy it in the state that you have your primary residence in. Unlike life insurance that you can buy anywhere from any agent, basically, as long as you're in the state that they represent. If I'm only a Florida licensed agent, I have multiple licenses. But if I have just a Florida licensed agent and wanted to sell you life insurance, I could sell it to you on the plane as long as it was over Florida airspace, even if you lived in California. On the health insurance side, you have to buy it in the place of the state that you reside. But with us, we are completely portable, so you can take it to New York, you could take it to Massachusetts. Some of these states will, after a year, sort of tell you if you keep it, you'll be taxed a little bit, and we'll talk some about the taxation. That would be the only other objection that we get. Will you be penalized if you have us? Incorrect. Big lie. Big lie. Now, if we called ourselves major medical, we would have to fall under the exchange. There's two ways. This is a great question. I hope you all understand this, and I'll try to run through it quickly. I don't want to eat up all your day. Sure, good. Good for you. Good. There's the exchange is the healthcare.gov. That is the exchange. Okay, that's where you have to go if you want to try to get a subsidy. It's the only place to get a subsidy. And again, to me, the subsidy is unsustainable. It's a piece of cheese trying to. Fair enough. The exchange. And then there's still PPACA plans that sit outside the exchange. In fact, most of the plans sit outside the exchange, including our ACA plans. We opted not to go on the healthcare.gov, but we still can sell all the other Obamacare stuff. Okay? We just don't. We're telling all of our healthy friends, don't do it, even with our products. Don't do it. The prices are going to go astronomical. All the actuaries, from the IRS actuaries to the president's actuaries to all the insurance actuaries, the people in the know, all feel that the Obamacare plans as you know them today will double or triple by the year 2018. If they're already $2,000 a month for a family, a decent plan for a family of four, can you imagine if it's $6,000 a month? Where is this cost break prohibitive? I say it's already now. I've done this a long time, and we're going to show you a great way. If you understand what we do, you'll want to be you want to have insurance with us. I truly believe that. Okay, and we'll keep going a little bit. But there's exchange products on the exchange, healthcare.gov, off the exchange that can be sold without subsidy. You call Blue Cross and get on it. No medical questions, only one, whether you smoke or not. Fair enough. And then the third way is a way that sits off the exchange and off the PPACA rules. We filed outside. We're the only company. And we copyrighted and trademarked everything we do. And God bless my company for thinking of you in front of themselves when this law was passed. There are certain ways to go about it, though, that had to be filed in each state to make sure that we were still able to underwrite. If you get down to my whole drift, it's this. If you're healthy, go with us. Don't go with all the unhealthy. Would you rather be with a group 1, 2, 3, 4, 5, 6, 7, 8, 9? There's 9 of us here. And we're all perfectly healthy. And we buy, and the boss goes out and buys us a group health program. Rates, not too high. You use it for $1,000 a year. Use it for $2,000. You don't use it for nothing. You use it just for your physical. Birsen breaks a leg and has a $5,000 claim. We had 3 doctor visits. We have a total claim of $15,000 between the entire group of 9, and we had a $5,000 deductible. The insurance company didn't pay anything anyway. Premiums stay relatively low. Okay, maybe they paid for a physical, maybe they paid for a few things, but not much. We work off 0 deductibles, by the way. First dollar coverage, so the insurance company's on the hook from the get-go. Very simply, sounds pretty good. Okay, and the president or the administration comes in, or whoever you want to blame this on. Harry Reid, Nancy Pelosi, we go down the list. Come in and say, hey, guys, look, you have a group of 9, and your premium's, running about $50,000 a year, and you all participate in a little bit and stuff. Wouldn't it be great if you had a group of 15, though? It would keep that premium dollar down. Wouldn't that be great? They'll split the risk. Boss says, okay, sounds good. They say, great, you have 6 new employees, roll them in. And they come in on gurneys. Come in wheelchairs with oxygen tanks, come in their AIDS patients, they're heavy drug users, whatever the case is. I hope you catch my drift. And premium, the amount the employer pays and the amount we participate, is based on the claim loss of everybody. And they just willed in 6 guys that are using $200,000 a year in the health claims. What will happen to our premiums? They'll go crazy. Would you rather be have your Geico with 1,000 pretty good drivers, or would you rather be in the group of Geico with all the DUIs and the crazy drivers that have wrecked 5 cars over the last 2 years? It doesn't take a rocket scientist to know I want to be with the healthy people. I want to be with the good drivers. I'm a good driver. I want that spread of risk. That's what insurance is really, is spread of risk, isn't it? Okay. I'd rather spread the risk with people that were healthy, but also I want to know that if I become unhealthy or from divorce, if one of my children became unhealthy, that my rates aren't going to move. I'm not going to be canceled out. I'm going to have freedom to choose any doctor, any hospital, 24-hour day coverage on and off the job. These are things that P-Packet does not offer. You understand that P-Packet doesn't offer anything on the job. They expect that you have workman's comp because everybody works for a big corporation. Nobody's really self-employed, are they? Of course we are. In fact, all the big companies in this corporate type of style government right now, let's face it, they're corporate friendly. They're not small business or self-employed friendly today. Some of the people are, but for the most part not. Not everybody works for Nike. Not everybody works for Disney. Not everybody works for GM. And all those companies all started from just like you have. Small. Okay? All of them. Think about it. So we are the backbone of America, always have been the backbone of America, the highest growth of new work for, how many men? 1, 2, 3, 5, 6. 75% of men have their first job with a small business. In case you didn't know that. Might be, whatever it is, that's who gave us the first chance. Okay. Anyway, we're 26 compared to 4. If you notice these numbers, this is all about customer service. Statistics taken from the National Association of Insurance Commissioners closed complaint reports. We had 26 out of 15 million. We do a dang good job. We ain't perfect. Perfect would be 0, but we think we do a pretty doggone good job because we really work with you. Our customer service is the best. We win all kinds of Stevie Awards. Stevie Awards are like Grammys for business. We win them all. Silver 2 years running for customer service, for example. Pretty awesome. I mean, we're competing with thousands and thousands and thousands of companies. Of the claims received, 88 were processed within 15 days. Our average time service is 10 days, not 10 working days, but 10 calendar days. We pay the claim quickly because we underwrite on the front end. So when we get something that processes, and one person makes sure it gets processed all the way through for you. The claims go to a PPO repricer, okay, and it's all done electronically. So when you go into the hospital and they bundle up the bill, they send it to our claim department, which electronically sends it to PHCS or Cigna if it's in network. It's repriced, comes back to us, and we pay the bloody claim, and we pay it quickly. Nothing. I hate having insurance, and 30 days later, the hospital is calling you up and saying, "Where's the money?" And you're calling your insurance company, "Where's the claim done?" "Oh, we don't know what claim." Or they stamp it pre-X or whatever the case is. Now with Obamacare, they won't hit pre-X because there is no pre-X. That is one good part of the law. We pay our claims quickly. Like I mentioned, we win all kinds of Stevie Awards. I think my favorite one is this bronze one. We took that in Chicago when they did them last year, and we're the 3rd most innovative company in America. Jim, you guys are like an association, an insurance company. How in the world do you win an innovative award? It's how we're handling the Obamacare laws. And that's why we won. The team that won takes oxygen out of the air and makes plastic out of it. I don't mind coming in 3rd to a company that can do that. Just a little bit about Secure Care. It's our top selling product, and where everybody is buying it that we meet with that can qualify. You do have to be healthy enough to get in to this product. You don't have to have perfect health, but you have to be healthy enough to get into our 15 million. Okay? And very simply, here's what it does. We're the only company in America that allows you to upgrade your coverage when you need it most with no additional underwriting through our exclusive hospital confinement rider. We do a 3-year rate guarantee at a time. Over 85% of our customers renew this product after the 3-year rate guarantee. And then we're locked in for 3 more years. So projectively, in 6 years, you only have 1 rate increase. And that will be spread amongst everybody. The average rate historically is about a 5% rate increase. So in 3 years, you'd expect, you're 3 years older, you'll expect about a 15% bump up in your premium. And then you're locked in again for 3 years. How long is the Obamacare rate guarantee? You know it's actually 0. There is no rate guarantee on it. they could move it. They'll probably not move it because the president's really, there's a lot of money going under the tables here, guys. Okay. Um, so anyway, we think that's pretty cool. 85 out of 100 people renew with us after 3 years. In our industry, when you're self-employed, that's a phenomenal statistic. Okay. We have over 50 collective years in experience, and again, we have 15 million customers we serve. Dependable. We have over $1 billion in claims paid. By the way, we're owned by Credit Suisse, a $1.7 trillion company. We're not going anywhere. We're paying the claims, and we get them paid promptly and quickly. Secure care difference, no annual deductible. This is first dollar coverage. You can do it with doctor visits or without. I carry mine without. I still have my Call MD. I pay for my routine physical after pre-negotiated rates. Just joking about the 5 years. I probably do get a physical every other year. It's about $140 after my pre-negotiated rates. We can pay for them or not, up to you. I chose not to. My kids are over 18 now. Don't have a wife in the picture. My daughter maybe goes once a year, once every other year. But even her Bactrim, she gets a urinary tract infection about every other year. Bactrim works. She uses Call MD for it. My son gets a Claritin prescription for his allergies about once a year during the seasonal time. He calls MD. Doesn't have to go to the doctor. Again, it's free. I think between myself and my 2 children, other than accidents, in the last 3 years, we've had 1 sick visit. My daughter gets a physical every year. Obviously, I just pay for it out of pocket, about $150 for her physical after pre-negotiated rate. And if I'm saving $3,000 a year by not paying for my doctor visits and only having to pay for 1 or 2 physicals or a doctor visit, it's a no-brainer. When it comes down to it, Fort Jefferson, I look at the total package for my folks, as Birsen does too. We look at the total package of what the total outlay of cost is. Isn't that the most important deal? Okay. Yeah, it'd be nice to have 0 deductibles, 100% coverage, everything covered. But if it was $3,000 a month, it'd be worthless for most anyway. Okay. So you'd buy more coverage when you need it without additional underwriting. I'm going to talk about that very quickly. Any doctor, any hospital, again, using the PHCS and Cigna networks, you'll get a better deal. I stay within my networks. We can look them up online, whatever the case is. They're easy to use. I'll talk about what a fixed indemnity is very quickly. Not subject to the federal health care mandates. This product is not subject to the federal health care mandates. Jim, does that mean I'll be taxed? By law, yes. I'm going to give the wink wink if you're watching the news and watching Megyn Kelly or anybody and reading anything, if you're keeping up to it. They've let everybody slide on the tax by not carrying a exchange product, okay, except for self-employed. So about 10% of the population is the only people. James Carney, the president's White House staff guy, he always says, man, what's everybody talking about? It's only 6 to 10% of the population that will be taxed. That's my 6 to 10%. You're damn straight I'm mad about it. I feel discriminated. I don't think this tax will come to fruition. But if it does, I'll show you something that even with the tax built in, we're 10 times the better deal. 10 times. Particularly if you understand what's going to happen to the PPACA prices going forward. So I want to address that you could be taxed. But IRS already said this year for 2014, all you have to do is state that you couldn't get on the website and we won't be able to tax you. That's an easy one. All right. Lock in your rates for 12, 24, 36 months. Most of my clients do the 36-month option. It's only a couple more dollars a month to make sure your rates are locked for 3 years at a time. Okay. 24-hour-a-day coverage on and off the job. We can tailor make the programs to each of your needs. So you might not want doctor visits, and you might. Birsen can help you out either way. Okay? You can tailor make it. We're not a cookie cutter company. Obamacare is cookie cutter. You get this, and pregnancy is important to you, right? Single, over 30-year-old man, right? I mean, you're not planning on getting pregnant tomorrow, are you? Okay. Sex change. Fair enough. Good. Do you want to pay for pregnancy? Is the word. Do you want to pay for sex change operations? Do you want to pay for drug addiction treatments? Do you want to pay for alcoholism? Those are some of the things that we opt away from, but you can always add to it if you become an alcoholic. So it's kind of neat. Okay. I don't want to pay for pregnancy either. I'm done. I'm like you. Portable coverage, you can take it with you even if you change jobs where you moved. 96, I love this triangle. 96.4% of all claims on any given year to any one of you are under $5,000 collectively. So if you have a $5,000 deductible, 96.4% of the time, you have no insurance anyway. Insurance company gets to take that big bag of money and go back to their home state with it. I bet you we could do this real quick. In the last 5 years, have you had over $5,000 in claims? Fair enough. I've had 3 hospital stays in 22 years with between myself and my 2 children, not counting the 2 births. All 3 were accidents, and all 3 of them I made large amounts of money while we were in the hospital. While my son was in the hospital for an accident, while my daughter was in the hospital for an accident, while I was in the hospital for, I played all kinds of sports in my life, and church, softball. Guy slid into me like kung fu, 32 days in the hospital, had a lot of rebuild stuff. Good ankle now, man, it's great. It's better than my other ankle. But I was 32 days in the hospital. I walked away with, not only in the hospital, I walked away with over $28,000 in my pocket, which was real important to me because it helped me out. What? I'm self-employed too. It's nice. I like that. So the last thing I wanted to worry about was, man, it's going to cost me $12,000. I was making money. Association was paying me, and I'll explain how this product pays also. So most claims are under $5,000. We understand that. And you might be billed in $15,000, but the time the PPO gets it and renegotiates, $5,000. Okay. But Jim, what if I had one of those bigger claims? This product is built to eat these up, to eat up a $100,000 claim and below. But if it went over $100,000, we're going to give you an option to buy into. Listen closely now. This is the big selling point, right? This is the big. We're going to give you bulletproof coverage from first dollar coverage, so you're going to get coverage here where you don't get it on major medicals. Everybody with me so far? Or close enough? We're going to give you the ability to buy into a Platinum EHP, Essential Health Plan, Obamacare, Metal Plan. They're all the same acronyms, what you were looking at on the exchange. We're going to give you the option to buy into an EHP plan instantly anytime you're with my product. Anytime at all. So you don't have to pay for that super catastrophic stuff until it happens. And this is where you're going to say, Jim, this is too good to be true. Here's how we did it, and I'll tell you why we did it and everything else. We know that self-employeds have a very low tendency to have these huge $300, $500, $1 million claims. We just don't. Not say never. I've done this a long time. Obviously, I've had a few claims that were over $500,000, okay? Haven't had a heart transplant patient yet, usually, but it could happen anytime. We do a thing called MedGuard to supplement. When I get to the prices, you're going to love them. But we understand that not many self-employeds, in fact, only 1 out of 1,000 a year will have to move to an EHP plan because they won't have that over $100,000 claim. Here's even more beauty to it. You can call us up and say, hey, my wife's in the hospital. She has stage 3 breast cancer. I use breast cancer a lot because we understand it. Okay, everybody knows somebody. NFL wears pink for a month, right? Because it's it's a common disease, common enough. She's stage 3, and I'm thinking of moving to the Platinum plan on just her. You wouldn't have to move your whole family. You could just move her with additional premium, right? You can keep the Secure Care plan that you're on here. And the money that the Secure Care would have paid the hospital, the Platinum has a $950 deductible, 100% coverage of all covered expenses, including pregnancy, including alcohol treatment, drug addictions, whatever the case is, all what the president mandates into their plan. You can move just her to that Platinum plan. Keep her on the Secure Care if you so desire. Jim, you're paying 2 premiums. One's very low, though, and one's a little bit higher. Platinum's going to be high. 950, 100% plan. And let's say she had the $300,000 claim that was pre-negotiated down to $180,000. We'll pay $179,050 through the Platinum plan. And the indemnity plan, let's say, had $100,000 to pay out. Indemnity means it's going to be paid out, just like Aflac. Okay? It's going to be paid. But since the hospital was already paid, where does the $100,000 go? In your freaking pocket. Almost cursed there, sorry. In your pocket. It's cool. And I'll tell you why. Because that platinum plan, she's probably going to stay on it, right? She's probably, man, with breast cancer, we've got to make sure. You'll be the only one in the hospital, your wife will be the only one in the hospital that not only has no out of pocket, but has 100,000 that has free insurance for 10 years. Not counting some of the MedGuard and not counting what the association would pay, that $800 a day while hospitalized. Jim, that's too good to be true. It's the only objection I get. We just know that most people won't have to do it. And because you guys are very studious, I could tell, and I know I'm being boring a little bit, but I don't apologize. We also know this, that most people that end up on that platinum plan because of that catastrophic will probably stay there. And the next year, they might even shop for a silver plan to try to reduce that premium a little bit. Because it's not a huge deal, but platinum plans are going to be expensive. But the reason we want you to move to a platinum plan and not a silver plan is we don't want you to be subject to a $6,250 deductible. Do the math. We've done it for you. We've done it over and over. This thing is the best thing since sliced bread ever. So the Obamacare law is working in your favor the way that we're doing it. As long as you're healthy enough to qualify into the plan. We have guaranteed issues. I do work with some other navigators if people want to shop. If you're 6 months pregnant, we couldn't take you on that plan until she delivered, for example. Can't even take a pregnant dad. Well, why can't we just put her over there and I'll be on it? Because you're a pregnant dad. Because we have such great guarantees that we guarantee to insure your offspring no matter how they're born since she's already pregnant. Good. You understand all this? I forgot 2 years in the insurance thing. So I think you understand why we've married a fixed identity to it too also. And I want to let you know this too. I've had a client about 3 weeks ago that had a high blood pressure behind the eye, and they had to have surgery on it, glaucoma, and didn't have to switch, didn't have to do anything. We paid the anesthesiologist, the surgeon, the surgical facility, paid him enough money, stayed within network. The guy did a real good job of staying in network and gave him a check for $2,800 on top of paying the claim. That's what indemnity can do for you. And we're a very lucrative indemnity, okay? Unlike some companies that use the Medicare allowable amount, we don't. We use the PHCS pre-negotiated rate that will meet or exceed that rate every single time. So if you're out of network, it can come up a little bit short. If you're in network, you tend to get a little money back. We reward you for trying to stay in network. We don't punish you if you go out of network. Routine wellness and health screening fixed benefits. If you decide to have your doctor visits covered, I choose not to. I like saving the money. I don't run to the doctor too much. And a $50 doctor visit does not scare me. A $500,000 claim scares me. I have a house in Nashville and one down here. Yeah, I don't want to lose anything. But if you want the smaller things paid for, we can do that. Outpatient fixed indemnity benefits for your doctor office visits, prescription drugs, diagnostic x-ray, labs, chiropractor visits, ER, emergency air and ground transportation, specialty radiology, CAT scan, PET scan, MRI, radiation, chemotherapy, outpatient surgery, surgical facility, and kidney dialysis. Please note the asterisks. On the lowest price plan that we do, with the zero deductible, we wouldn't pay for radiation chemotherapy, outpatient surgery, surgical facilities, or kidney dialysis on some of the plans unless you wanted to move up to the EHP. Why? I'd like the price point to be low. Most likely you don't need kidney dialysis. I cover everything for accidents real good. I mean, that's what me and my 2 kids have the deal. But we also have a secure care plan on the lowest plan that would pay for outpatient surgeries, but not for doctor visits, and that's the one that I've chosen. Okay, so you have 2 different ways to go here, with doctor visits or without. Okay, you can either pay for your physicals or we'll pay for them either way, and Birsen can work with you individually on how you want to choose it. Well, Jim, if it doesn't pay for kidney dialysis, what if I did get kidney dialysis? Let's see how well you're listening. You know this answer. If you had kidney failure, you would do what? You would call us up and say, I'm thinking of moving to the EHP plan. And then when the bills start, you have 45 days from that phone call, by the way, to make the decision to move. And you don't have, let's say you're on us for 4 years, you don't have to go back and pay 4 years of premium. You pay for that date that you made that timestamp and say, I'm thinking. Jim, what if I was in a coma? We got your back on that too. We do understand all that. Whenever you're hospitalized, by the way, there's a light switch, if you will, that goes to our customer services. One of our clients is in the hospital. Let's call him up. He's in a coma. Great. We just need to make sure that you have his insurance card or here's his ID. Okay? And we got your back there. We understand that if a friend or family are going to call for you. And I was in a coma for 3 weeks. I'd like to have this. We got you. We're going to put it back to that day. Okay? So the reason is, this is neat. You don't have to pay for it unless it happens. I just think it's awesome. Doctors available. There's CallMD. You know, I talked about it, and just for fun, you'd see top 10 conditions treated, but the top 10 prescriptions, number 5 is a fun one. In all honesty, CallMD is too cool. I mean, you run a pretty neat shop. They just started, and you got it all looking great and everything else. You got some great people working with you. You don't want to miss a board meeting with everybody, and if you can call in and at midnight and get a prescription called, or you can go sit for 6 hours at a walk-in clinic around a bunch of stuff. It's just a cool deal. These are the fixed indemnity benefits, and this again is with the doctor visits. We pay $60 towards the visit charge. Okay, the average pre-negotiated PHCS doctor visit we'll get about $100, 90 to 110 billed to us after it's pre-negotiated. General practices, pediatricians. My daughter's pediatrician, for example, is $57 for his doctor visit after pre-negotiated rate. So they send $57 to the doc. They pay for some of the tests if she has X-rays or whatever. I know it sounds stupid, but I get a check for $3 when she goes to the doctor. You know, whoop-de-doo, $3. When's the last time an insurance company sent you a little bit of money when your kid had to go to the doctor? Jim, what if it's a specialist? You'll be out about 30 or $40. It's about a copay anyway. Birsen can go through all these with you, but I want to touch on a couple things. We really step it up, even on Plan 1, and we have Plans 2, 3, and 4 also that are increased, okay? But most people are buying Plan 1 because why? Same, it's simple. If something disastrous happens, you can step up to an EHP plan, Platinum. It's like this is really a no-brainer. It really is a no-brainer. Do the math, and I'm going to show you some math here, and we're pretty close to finished, actually. But you can see we really step it up if you go into like life-threatening cancers, burn units, and things of that nature. And if you stay within network, you'll be bulletproof. If you go out of network, you'll owe a little bit, and then you might move up to the EHP. You understand that the EHP that we allow you to move up to is a $950 deductible, 100% coverage, and all these monies that would be paid to the hospital go into your pocket instead. For an extra, what, Jim? Well, maybe $100 a month to get $72,000 in checks, or $28,000. Yeah, that's it. We only allow you to move one time up with no waiting period, by the way. If you decide to come back down to us, then you're subject to the same rules and regulations. And most of the ACA plans, the Obamacare plans, are starting to suggest, hey, after March 31st, you can sign up in April. We'll have you insured January 1st, 2015. Because they don't want to take the people that are going to be coming in because they're the sick. What deadline? It's been pushed off 50,000 times. The law, I like our presidents. Actually, I think he has a great demeanor, and let's face it, he's a great orator. We'd all want him to work for us, I think. He's a great salesman, unless you want a salesman that's ethical and tells the truth. So anyway, Plan 1, Plan 2, and you can see some of the benefits there. Always tends to work, and here's what I'm talking about. On level 1, we pay up to $100,000 per person for inpatient, $100,000 per person per year outpatient. So, Jim, if it's going to go over $100,000, am I still bulletproof? You're more than bulletproof. You'll make money. It almost pays to get very sick, but no one wants to get cancer to make $100,000. Let's face it. So, you cure your peace of mind. I'm going to read this aloud to you so you know that what I'm telling you is factual. Of course, we hope you'll never need to be hospitalized, but if hospitalization occurs, you'll have peace of mind knowing that your secure care plan hospital room and board fixed indemnity benefit, your hospital ICU and daily room and board, and your hospital miscellaneous expense fixed indemnity benefit will automatically increase. And I'm going to go back here first. For 7 days, we'll take these numbers and multiplying by 250% if you're hospitalized if you carry our HCR rider, which we build it all in, because the HCR rider is also the rider that allows you to bridge to the EHP Platinum plan. Okay. The automatic increase means one less thing to worry about when you're focused on your health. There's no need to contact the insurance company or take any other action. Your increased hospitalization benefits are activated upon hospital admission and will continue up to 7 days. And if a serious medical event results in a longer hospital stay or increased medical expenses, your optional hospital confinement rider gives you the right to purchase one of our essential health plans with no waiting period, even in the middle of a claim. Jim, what about if it was June 20th? Can you still? Yeah. What about if it was a Tuesday? Yeah. I mean, I can change if I wanted, if I was on a plane, if I was on a train. Yes, Sam, I am. You can. Okay. I mean, that's the deal. What a deal. And Jim, why is this too good to be true? It's because we still are selective on the front end. We know that if we can gain your business, we got your back, bulletproof. We most likely will still make a profit on you. You want us to make a profit. We want to make a profit. Okay? You do too, because it means you stayed healthy. But if you lose your health, we spread that risk amongst 15 million. So your rates don't move. You don't get canceled out. Just makes perfect sense to me. So, Jim, why do you all call it a bridge? Well, here's your fixed indemnity benefit, first dollar coverage. Hope you understand that. Kid breaks his leg and goes to ER. Doesn't cost you a penny. Don't have to meet a deductible. Get usability out of your insurance. All right. Qualified catastrophic, the platinum plan, $950. When you do all the math, there's a reason we want you to go to $950. It's the best deal for you. You have the least out of pocket. And this is the bridge called the hospital confinement rider, and it's a bridge between these two. Hopefully you never need to use it, but you could use it and still not have to go here. You don't have to make that decision till your bills come in. Gosh, you got fixed indemnity did a pretty good job. $38,000. Man, they paid $28,000. I owe $4,000. It's a pretty good deal. Man, if I jumped to the EHP plan, I'd only owe $950, and I would get all that $28,000 in my pocket. Okay, I'll do it. You probably would. The $3,000 outpatient surgery, when we pay $2,500, and you probably don't jump to the EHP plan. Who cares? It's a great question. Somebody when I do a lot of training with new agents, and I gave credit to credit's due. We had the same question come up, and I said, well, let me explain. And the guy said, Jim, the answer is who cares? Because Obama wouldn't pay you anything. Would it be taxed if you're writing off all your health insurance premiums? That could be a taxable deal, but I'd rather pay taxes on $28,000 than owe $15,000 and not pay any taxes on. Okay. Sort of like I would tell you to talk to your accountant. It depends on how you set everything up. If they don't 1099 me for it, I probably not reporting it. Oh wait. 950 deductible, zero co-insurance. So here's a few of the things that we pay out, and we just increased these, by the way, to 800, 600, 500, 4, 3, and 2. A little bit story, but they decided to give you a little bit more money while you're hospitalized through the Southern Consumers. I just got back from a trip to Dallas last week, and we are so cool company. I really am proud of us, and I'm proud of what we ultimately do, and that's help you. That's why we have a long-standing relationship. By the way, our average client stays with us over 9 years. In this industry, that's phenomenal. Okay. If you carried your own insurance before, how often did you? I carried Blue Cross Blue Shield. They gave me a good price. 2 years later, it was triple. So I canceled them. And I went to Golden Rule for a year and a half, and they didn't pay a claim. I got mad at them. And then I went to Aetna. We built in a little critical illness, too, that helps pay some. I'm just going to show you an example. That's the easiest way. And, again, more to fixed indemnity benefits. Let's take a look at some claim examples. Here's a hospital claim, heart attack, 5-day hospital claim. The total claim was $47,000. The PPO discount was $21,000. Balance due was $26,000. with the plan that we're on, without jumping to the EHP, you would have made $3,598 if you stayed in network. I'm going to go back there. If you stayed out of network, you would owed, you wouldn't have had that 21,000 discount. You would have owed 18,000 on it, and probably jumped to the EHP if you were out of network. Okay. I always tell my clients, when you go to the hospital or have some big outpatient surgery, just call us and let us know that you're thinking of going to the EHP. You don't have to make that decision. Just timestamp it that you're thinking about it. You have a 45-day window from that to pick it up. Let's see. Oh, and it goes back here, by the way. If you did step up to the platinum, you would have made $29,000. Not counting MedGuard and not counting the association. Hospital 4-day stay, ICU, blah, 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 $28,000, $13,000 discount, balance due of $14,000. This plan, you would have owed $856 had you not stepped up. Still better than a $5,000 deductible, right? Okay, doesn't take a rocket scientist. If you had moved up to the EH plan, $14,000. Once you move up, though, if you want to come back and drop the EHP, you can, but that one person, and by the way, the whole family, again, doesn't have to go up, just that one person. But you've used up that one time, man, I'm going to jump to the EHP. So it's a little bit of a balance there. But if you understand it, doesn't mean any hill of beans difference, because the EHP, just like Medicare, has an open enrollment every year. So you can always jump to an EHP plan on any given year with any company, except the prices are going to get big. All right, that's the a third claim, a $96,000 major accident. PPO discount of $40,000, balance due of $56,000. Here's a person that without the payout would owe $950. If they had moved, they would have moved to $16,000. I'll tell you, I make sure my accidents are bulletproof. I put little riders on my policy because it's still very effective. The association has $10,000 built in for any excess accident too. I've made money on all three of my hospital claims, and I've made rugby, church, softball. My kids are athletic and outdoors. We've had a lot of little, like, ER visits. Never owe a penny. I love it. I think you got it, right? The EHP, you'd have, let's use $1 million claim. Jim, I'd make probably $100,000 on $1 million, not counting the MedGuard and everything else. Yeah, you'll be the only one with a heart transplant who has free insurance for the next 10 years and nothing out of pocket. We do some other things, and one thing I'm going to show you on a quote is I put income protector. We do some life protector right through it, if you so desire. I do an income protector. I put $1,500 a month of. It's not a whole bunch of disability, but if you get hurt and can't work, it's 30 days. You just have to be out of work 30 days before it kicks in. It's only $1,500 a month we're going to give you, and only good for 12 months. It's very inexpensive. But self-employed, it's better to me than the long-term. It doesn't hurt to have long-term disability, but most of them have a 5-month wait. Most of my clients are out of business if they haven't had income in 5 months. But 5-month wait, and might have a 5-year payout. But if you ever look at trying to get like $6,000 a month for 5 years, get your checkbook out. It's about $850 through Met if you're self-employed. This is $25 to get $1,500. Jim, $1,500 is not a lot. It'll pay maybe for your mortgage. It'll definitely pay for your health insurance, and that's one thing you cannot afford to do without when you're hurting. So again, we build to make a complete benefits package, including nationwide group to help you control costs, business services to help cut money off your overhead, family and lifestyle benefits to help save money, health and wellness benefits, group health insurance, nationwide group control rate lock, controls rate increases and rate lock. Call MD, we talked about accident benefit to help cover any out-of-pocket expense so you don't have to worry about an accident forcing you to an EHP. That's what 75% of your claims that are pretty big will come from an accident. I want to make sure that you don't have to jump to an EHP plan just because of an accident. Lost wages, we talked about. Life insurance, we can put on 24-hour a day on and off the job coverage. That's important to you guys. I have a realtor that is my client, been my client for 18 years now. She's out of Nashville, Tennessee. But before she came to me, she got in a wreck on the way to a showing. Blue Cross denied the claim because she was in process of her work day. She had her signs on. the magnetic signs that realtors use. And she was on her way to a work-related job and wasn't just coming out of her garage. She left her office to go. They denied the whole claim. We cover you 24/7, 365. I don't care what you're doing. So anyway, that's the PowerPoint, and I want to pop this open. I might need your help. Maybe not. Let's see. I'm trying to get there. Let's see. And I just play with it right here. Here it is. I see the cursor. All right. Okay, here we go. This is a cost comparison. And what I've done is I've taken a family of a couple, just two people, 54 years old. I made, let's see, I put him born in 65 and her in 66. Thank you. So I made them about, give or take, 50 years old, 49 and her 48, something like that. Okay. And I put a lot of neat things on this plan. Okay, this is the secure care plan that would pay for all your operations outpatient, would not pay for your doctor visits. Okay, it would pay for a lot of your big testing and all those kind of things, pay for accidents, it would pay for your doctor visits for accidents, still includes call MD, everything we talked about. I put MedGuard on here also that would pay each one of them $25,000, give or take a little bit of money. I think his was 20 and hers was 25,000 right away if they got diagnosed with any of the big 11. Cancer, stroke, heart attack, kidney failure, angioplasties, bypass surgeries, paralysis, whichever other ones I'm missing. Made sure I put a heavier association in there to make sure everything is paid for. Okay, what this is going to show. Got to learn how to do these guys. Oh, there we go. Good. And there's the whole PDF going down, but I'm going to get right here. The light green is the amount of premiums that it would cost us. This is how much you would pay in premium annually, $3,472. You heard me correct. This couple, $3,742 total premiums. The middle green, thank you very much. The middle green is the taxes that could be hit. So remember I told you I'd show you the taxes. I don't fly away from anything. Okay? And I'm just going to tell you, these are debatable, though, whether you'll even hit them. I'm going to tell you, you want to check a box that say you just couldn't get on the website, you won't have to worry about 2014. It's already documented. IRS already said they can't even keep it up. You watch it. I can't say it will go away legally and ethically, but I can tell you I've seen all this stuff before. I was in Tennessee when TennCare came. It's an unfair penalty. You know, it's funny. John Roberts, the Supreme Court guy, said it was going to lose 4-5 and then won 5-4 because he changed his vote. And he said, well, because it's a tax, it's not a penalty. The IRS still calls it a penalty on all their legislation. They don't call it a tax; it's a penalty. The president, Kathleen Sebelius, calls it a penalty to this day. That was a payoff. Anyway, that's the tax. Should it come? If it doesn't come, our prices are lower. This is the out-of-pocket scenario for the secure care plan compared to, this is an Obamacare plan. The red represents the out-of-pocket. Whose out-of-pocket is less in these scenarios? We are less out-of-pocket without moving to an EHP plan. On almost every circumstance that's under $100,000, we're less out-of-pocket. If it's over $100,000, you're going to move to an EHP plan. I'm going to tell you, but I would tell you when you call customer service to move, say I want to keep my wife on that secure care too, because it's going to pay you a lot of money. Okay. So that's the out-of-pocket on Obamacare and the prices of Obamacare. But I took a platinum plan. I can do a silver, and we could do that individually and whatever the case is. I can do a silver. I could do a bronze. You'd be surprised that the out-of-pocket, the total representation of these graphs are almost identical because you have a huge out-of-pocket on those with $6,250 deductibles. So this couple over the next 3 years, let's see, we put MedGuard on here, put association in here, going to pay you some money. It's got Aflac on steroids built in. zero deductible, the ability to move to an EHP plan anytime. It's a lot better than P-Packet, Jim. Why wouldn't I buy it? It's got to be more. Now, actually, it's going to save you about $30,000 over the next 3 years. And that's if P-PACA, ACA, Obamacare doesn't have this tremendous rate increase, which I feel it will be. I think these are very conservative graphs. I think we'll save you more. Would you rather have $30,000 built into your pocket, or do you want to give the government $30,000? That's about it. Questions? I'm done. It depends on health issues. We have underwriting guides and things, and that's better handled individually with Birsen. But certain things are pretty easy. We're great on high blood pressure, but high blood pressure plus too much weight can be a tough one. Depends. We're great on high blood pressure. What's that? High blood pressure, we're golden. As long as it's controlled. If it's not controlled, whole new ball game. Okay. Controlled high blood pressure, hardly any missed work, controlled through medication, no problem. Good. Cholesterol, we're great on, no problem. We're very liberal on height and weight, by the way. Very liberal. We understand self-employed or one way or the other, but we don't do rate ups. This policy. Now we have different policies. I want to let you know I carried over the one that makes the most sense in these ACA laws. We're great on height and weight. We're pretty good on most things. It is accept or reject, so there's no waivers you'll get on it. We either accept you and your whole body or we don't. We do have a 6-month wait on inner ear disorders, okay, just because they're too easy to hide. Okay. I used to pay $100 for that letter. What's your readings like? Are they 140 over 90 now? Good. We should be good. We good. Your height and weight looks good. But Blue Cross absolutely canceled you. Was that an individual policy? And that's why the law came about. Was things like this. Okay. Right. Because of Obamacare. All right. Now, he's one of the guys that if you watch the news, when I started in this industry in 1992, I used to pay, honest to God, I would pay $100 for that letter saying it canceled because it didn't happen too often. But when it did, and I'd show a new client and say, look, individual companies can cancel rates you out of coverage. No, they can't. And I'd say, well, that's what they told this guy too. Right there it is. They canceled them. Okay. I've seen the horror stories. In this case, when you got canceled, it's because they had a full gamut of cancellations come across the desk, and they were getting rid of all the risks they could as fast as they could. Oh, they wouldn't accept you. A little bit different. So you stayed with Cobra because they didn't accept you. Fair enough. Now, sometimes you get cancellations. Now, of course, what happened here in the great state of Florida and the great state in all 50 states, it used to be that if a guy got canceled, now this was, understand he didn't get canceled, he was just not accepted. He wasn't underwritten. We would have probably underwritten you here. I think we have a very good shot at underwriting you, no problem. If there's not a lot of other combinations, but your height and weight looks good. When people got canceled back in the 90s and 2000s, self-employeds, they would be front page of Newsweek, because the person was canceled, or front page of their local tabloids. A few months ago, we had 6.5 million people get canceled because of Obamacare. We have so many fun slides. I hate to bring out fun slides on PowerPoints, but I think you all can understand what I'll just tell you what it says, if I can recall. Obamacare, great idea. What we're doing is taking all the healthy people who once had insurance, canceling them all so the uninsurable can get insurance, and we can charge those healthy people twice as much to make sure the uninsurable get free insurance. I've got there's so many different things. We all hate Hitler, let's face it. There's that movie Hitler or whatever, they did a thing on it that we showed at the office once, and it's Hitler and all his chiefs of staff. He said, "Hey, Fuhrer, one of your guys, one of our people just got canceled. No problem. Tell him to go to Obamacare." He says, but sir, he has to be on the website. Yeah, just tell him to go on the website. Sir, the website's down. You have to see it. It's one of the funniest things on YouTube. YouTube, Hitler on Obamacare. It's just too funny. Too funny, but it's really just the funniest thing ever.